works. All right, we are Group 6. We are doing the Infectious Disease Society of America. So a summary of the resource. The Infectious Disease Society of America is a community of over 12,000 physicians, scientists, and public health experts who specialize in infectious disease. Their mission is to improve the health of individuals, communities, and society by promoting excellence in patient care, education, research, public health, and prevention relating to infectious disease. The IDSA clinical practice guidelines are developed by a panel of experts who perform a systematic review of the available evidence and use the grade process to develop evidence-based recommendations to assist practitioners and patients in making decisions about appropriate health care for specific clinical circumstances. The website, to access it, you go to idsociety.org. It is a free source that can be accessed by anyone who wants to gain any further information regarding infectious disease. There also is a membership available that provides subscriptions to multiple journals. There's discounts, IDSA news, ID-specific billing and coding resources, many professional development and research opportunities, and then IDSA also provides a lot of advocacy for funding of research and science-based policies, as well as work to promote the value of ID services and increase coverage for such services. There is an app available that provides easy access on the go if you want to look up any of the guidelines. It allows you to bookmark pieces of the guidelines so you can access it faster, as well as it provides some specific tools regarding antibiotics, antivirals, and antifungals.
Okay, so on the home page, you can go ahead and click on Guidelines, and that shows you many different guidelines about infectious disease. Other than being able to search up keywords about the topic you want, you're able to use the filter to focus on specific areas. So as we can see here, there's the status of the guidelines. Like if you want current, archived, endorsed, or in the process of being developed. You can also filter your search based on the organ system, the organism, and the data of the guidelines published. In the Guidelines tab, you can also see there's an app right there for the IDSA practice guidelines that lets you retrieve important information off your phone quickly. There's also a section that's able to give information about how they choose what guidelines to include and like the development process, as well as the panelist training that is needed. And the next feature that IDSA has is up-to-date information about multiple public health topics such as COVID-19 and antimicrobial stewardship. If we click on the antimicrobial stewardship, we get information about the topic that patients are able to navigate. There's also information that professionals are able to navigate to learn more about the issues, like articles that talk about developing programs and institutions for antimicrobial stewardship, as well as courses that are able to let professionals learn more information about topics. Each public health topic presents different information that pertains to the topic that can inform professionals and patients about it, or even the resources that can be used for other people, like in the case of a hurricane, then what pharmacies are open nearby, then they can search that up. Another feature that IDSA has is that they're able to target clinical practices and clinicians through different ways, such as programs like Antimicrobial Stewardship Center of Excellence program that's able to recognize the different resources and capabilities that an institution has. There is also a quality improvement in which it sets up different topics that calls for different fields to come together and make sure they're on the same page, such as the topic that needs 12 different members and regarding the misdiagnosing of UTI in women, in which their goal is to reduce misdiagnosing and by measuring the appropriate use of urinary culture testing only in the presence of UTI symptoms and in accordance with evidence-based clinical practice guidelines. The primary desired outcome is to correctly diagnose ASB rather than a UTI, and the secondary outcomes are able to reduce the antimicrobial overprescribing and antimicrobial resistance in CDI. There's also more information about how clinical practice and ID are related together, like how insurance is involved and how telehealth is involved, and able to open more doors to make sure patients are receiving the care they need. There's also the Research tab that can provide more information about research opportunity for the people that would like to participate in researching a specific topic or outbreak that could be current and may also be involved in developing a cure. These opportunities include fellowships, research opportunities, fundings, and grants. All of these can either provide you a link that can direct you to what needs to be filled out, or the process that may be necessary. Another feature is the professional development, in which IDSA can present different ways for you to get involved and learn more about emerging topics or continuing your education in ID. This could be like in events or meetings, like the upcoming ID week that's taking place in Washington. It also provides career paths for people interested in ID and what areas need ID specialists. IDSA also includes the future of fellow training programs and more information about fellowships, as well as what curriculums are needed for the different tracks that one could take with ID. There is also ways for ID specialists to get involved further by becoming mentors or others that are interested in the field, in which IDSA is able to provide a specific link that can be filled out.
The side of the page offers a variety of different search options. The first box includes current guidelines, archived guidelines, endorsed guidelines, and in-develop guidelines. The second box allows the guidelines to be organized by specific organ systems being affected by infectious disease, including respiratory, central nervous system, skeletal, soft tissue, cardiovascular, genitourinary, skin, gastrointestinal, and intra-abdominal. The third box allows for guidelines to be organized by different organisms, including bacteria, viruses, fungi, parasites, and HIV and AIDS. The final box allows for guidelines to be organized by the date they were published. IDSA also offers information about public health matters, which can be helpful in clinical practice. There are a variety of topics covered to help guide practitioners in their practice of promoting evidence-based public health recommendations. IDSA also offers research funding opportunities for those infectious disease practitioners who are interested. Another use of this drug information resource is the clinical practice information it provides to help clinicians increase their value in healthcare. Some examples of these resources include antimicrobial stewardship programs, compensation initiatives, quality improvement, information on Medicare reimbursement, and many more. Overall, IDSA is a drug information resource that is used daily in healthcare professions for its extensive resources of infectious disease treatment. The guidelines IDSA publish help guide practitioners in their decision-making, and there are several different areas of the website that offer knowledge and guidance to support the infectious disease profession.
Alright, so now I'll show you how to use the IDSA website to answer clinical guiding questions. Our first couple questions here have to do with candidiasis. What are the treatment recommendations for candidemia in non-neutropenic patients? So to get there on our website, we'll go to the Guidelines tab in the alphabetical guidelines list. We'll go to the candidiasis page, their full recommendations, and as you can see, it's our first question here with their list of recommendations as well as their levels of recommendation and quality of evidence. Our second question had to do with the treatment recommendations for candidemia and neutropenia patients. So we'll stay on the same page and just scroll down until we find that. As you can see, it's right here with also their list of recommendations, including loading doses and daily doses, as well as their levels of recommendation and evidence. Our last question had to do with cellulitis, and what are the preferred treatment recommendations in patients with recurrent cellulitis? So again, we'll go to the Guidelines tab up top and pull up the alphabetical list. And cellulitis is going to be under their skin and soft tissue infections. We'll go to their full recommendations and scroll until we find the question. And right here, patients with recurrent cellulitis, again gives you their list of recommendations with their levels of recommendation and quality of evidence. So as you can see, it's pretty accessible to find your guidelines and answers to your questions pretty quickly. And overall, it's a pretty fast tool.
Now we are going to talk about where the IDSA guidelines can be used in practice settings. In terms of setting, retail pharmacy is a more limited setting where the IDSA guidelines can be used. More often than not, a patient is coming from a prescriber's office or being discharged from the hospital or any other institution with a set of new prescriptions, usually for antibiotics covering a wide range of infectious diseases. A pharmacist is able to use this site to brush up their knowledge on a certain infectious disease state that they might not be as knowledgeable about in preparation for when the patient comes in, so they can provide any medication counseling and answer any questions that the patient might have. By clicking on the Guidelines tab or using the search bar, a pharmacist would be able to find those guidelines for any infectious disease and the management associated with it. Though the guideline managements for some infectious states are long, they are easy to use, and a pharmacist would be able to easily find the treatment section of a management article and look at the dose recommendations as an additional way to confirm that the person is receiving the appropriate dose. I would say that most retail pharmacists do not use the IDSA guidelines on a daily basis, but they should be able to access specific guidelines for disease states in order to gain the necessary knowledge to prepare for a patient coming in from an inpatient setting that requires the medication, and if they need any pertinent education as well. Now, with the institutional settings, like in a hospital, the IDSA guidelines are much more vital and is much more utilized and depended on. The antimicrobial stewardship pharmacist on duty will use this resource daily to look up guidelines for their admitted patients who come in with an infectious disease. From there, they are able to search for the disease state using the marked tabs to specify their search and look up a disease state to begin their treatment plan. As the ID pharmacist, there is a lot of responsibility and an urge associated with how they proceed when a new patient is admitted with an infection, since everything is time-based. Since the guidelines are so specific, it often puts the ID pharmacist in a position with a few solid options for treatment initiation, and appropriate fallback if the initial regimen proves to be unsuccessful. The guidelines will tell you how to initiate treatments, what labs to order, how to proceed with culture draws, how to monitor for pharmacokinetics and pharmacodynamics, but more importantly is how to bring all of this together when optimizing a regimen that is likely to be continued outside of the hospital once the patient is well enough. The continuation of this therapy with a solid foundation is of absolute criticalness, and the IDSA guidelines do a good job of allowing an ID pharmacist to conduct and provide an optimal patient care regimen to decrease complications, adverse infection, and overall increase the infection resolution. For other resources comparable to the IDSA, I found eMedicine Medscape as a useful tool that's similar to the IDSA, providing evidence-based content that is updated regularly by over 8,000 healthcare providers, authors, and editors. This tool is free to use with an account after submitting some practice information like your NAP ID and MPI number, and it gives you access to treatment-guided clinical therapies for specific infectious disease states. This tool, much like the IDSA, is often used in institutions when comparing viable treatment options. Overall, the group recommends this resource as the website is easy to navigate when looking up guidelines and provides in-depth analysis of each infectious disease state. In addition, the site is easy to access and has a mobile app, which too provides a more convenient approach to finding information when on the go.